I will start with a thought that probably you know very well. It's coming from a person who is meant to be the father of the modern management. This is Peter Drucker. You can't manage what you can't measure. And kind of second part of this thought, if you can't measure something, you can't improve it. So is this really valid when we talk about access? Can we really measure access? And can we really improve access? If we can't measure it properly, can we really manage this situation and improve it in a better way? Because at the end of the day, when we talk about access and healthcare systems outcomes, I think we all have to remember the focus why we are talking about that, and it's about the patients.
It's not just about access, it's also looking at outcomes, and here we've looked, for instance, in the area of hypertension to see what kind of difference this makes in terms of health outcomes, and you can see here the estimate according to this study is 1.6 million quality years saved thanks to the use of generic medicines in hypertension, where millions, close to 50 million patients are treated. It's not really about savings, it's about better health outcomes. It's about treating more patients. This is what our industry is supposed to do, and I believe this is what we are delivering. Now, in terms of healthcare systems, what are we providing? Well, I think this is very fundamental for the sustainability of healthcare systems. So just one number, the IMS just did a study on generic medicines where they showed that without generic medicines to treat the same number of people, it would cost healthcare systems across Europe another 100 billion euros. So that just gives you an indication of what this would mean not to have generic medicines in there.
Take patient advocates. I mean, when you get patient advocates, you get more access and therefore you get more equity. If you looked at that purely on economic and efficiency terms, it's quite expensive to get the access to this population. In terms of return on pure health service terms, if you look at the overall society. So this is when the issues become interesting, because the way, I repeat this point, the way that our managers and many policymakers look at it is from a purely technical efficient perspective.
I don't think there is a healthy divide between the north and the south as such. What we see is there is a healthy divide in the center. Mm-hmm. And when we look to our figures in Belgium, we see that, for instance, in the capital of Europe, Brussels, we see that there is less uptake in medical services. There's no primary care there. There's hospital-oriented care. And what we are focusing now on these great and big cities in which we have to develop more actions, because we are confronted with more isolated persons. We are confronted with...
In the UK, we've been tracking improvements in health since the smoking ban came in, and I think it's fair to say that everybody is actually staggered by the improvement that did result. I think everybody knew it would make a difference, but the impact it's had and the speed of that impact has outweighed any people's expectations. So if there are any countries that haven't instituted it, far more cost effective than some of the other things that we put in place before, simply to encourage people to stop smoking.